Hi, I'm Ruth, physiotherapist at Complete Pilates, and I want to talk to you about back pain. What causes back pain? Why do we get it? How can we treat it? And what can we do about it to help to manage it for ourselves at home? This is a blog that we've had previously on Complete Pilates, and I wanted to update it for you in the light of our current situation of being at home due to COVID-19. I think it's more relevant than ever. We've got a lot of people who perhaps have back pain or have had back pain in the past who now can't access their normal clinicians, their normal providers for manual therapy and hands-on treatment. We've got a lot of people who are in different situations at home. Maybe you're working from home, you haven't got quite the right desk set up, you haven't got your perfect ergonomic chair. And that challenge is potentially giving you some aches and pains. Or maybe you're having to do homeschooling and it's really tricky with the kids, maybe getting down to their level, sitting on tables that aren't quite as comfortable. The other things that are a challenge at this time that can have an effect are maybe not sleeping so well, maybe feeling a little bit stressed. So I wanted to kind of delve into that a little bit for you and see what we can do to help and what you can do to try and help yourself as well. So why do we get back pain? There can be a number of causes. One can be non-specific low back pain. We often hear that diagnosis and it can be really frustrating because oftentimes we want to know what's causing it, what the specific cause is. But ultimately, we don't always know. Sometimes we get aches and pains and we don't know where they're coming from. There's no clear kind of piece of your anatomy that's causing that pain for you. But the great thing is that that pain often will go away by itself, and there's certainly things that we can do to help it along its way. Sometimes back pain can be what is called mechanical, so it might be to do with movement of joints, muscles, soft tissues such as ligaments and tendons. There might be some injury to those tissues as well. You can also get pain for postural reasons, changes in position, changes in the way we're loading our spine or not loading it and not moving it, and how we are sitting, moving, going about our daily activities that can cause us pain sometimes. Along with those postural changes, we've also got a lot of changes at the moment just in our activity levels. You know, you might not be going to your normal exercise class or being in your normal exercise routine that would normally keep you fit and well. You might find, like me, that you're sitting at home a lot more. And our spines don't really like sitting. They're built to move and be mobile in a variety of directions. So if we're sitting, we're staying still a lot more, you might be more prone to getting back pain. So what should you do? I think the advice really needs to try and stick as closely as possible to what we would normally advise. So seek advice, speak to an expert. There are lots of people offering online consultations. So ideally that would be with a musculoskeletal physiotherapist who will be able to speak to you about your symptoms and look at you moving and see what's likely to be causing your pain and what you can do to help. There's also GPs offering online consultations. Speak to your GP practice, see if you can speak to your usual GP, or they'll be able to direct you where to go if not. Don't forget about medication. If you are in acute pain, it's okay to take some painkillers. Obviously, you just need to check that that's okay for you to take and safe with any other medications that you take. But often taking a simple paracetamol will just help to kind of get a lid on the pain so that you can be moving and exercising and doing more to help prevent it coming back. Are you also considering the kind of psychological and emotional side of things? Things can be quite stressful at the moment with changes in work situations, home situations, possible fears and anxiety around health of your family and friends and your children. And those things can sometimes cause an increase in pain that we might be feeling or have an effect on it at least. So are you taking some time to just consider that, consider the emotional side of things, give yourself some time to just be in the moment. Perhaps you're used to meditating. Now would be a really great time to bring that back into a regular practice if you haven't already. I would really recommend the Waking Up app by Sam Harris. It was recommended to me by specialist pain physio Richmond Stace. It's an excellent way of getting into meditation if you haven't before. The other thing linked with that is just giving your body recovery time. So are you getting enough sleep? Sleep is really important and massively underrated in terms of helping to control aches and pains and helping you to feel better overall and experience less pain. I think it's difficult at the moment when people are potentially thinking, oh, you know, I don't have to get up in the morning, get on that early train, I'm just working from home. So you don't necessarily get into such a good schedule with bedtime. You know, maybe you're staying up late and binge watching Tiger King on Netflix. Try and be stricter with yourself. Try and make sure you're sticking to a good bedtime so that you know you're going to get a good chunk of sleep, ideally up to 8 hours of sleep, so that you are having good recovery time and it will help you to control any pain you might be getting. Obviously, I'm going to say this one, but you need to stay active. We need to keep moving. We need to keep exercising. If you normally go to a regular group exercise class, have you considered doing that online? I've been so impressed with the multitude of classes and instructors and trainers who are now working online doing virtual classes. You can do that with Pilates, you can do that with yoga, you can do it with all sorts of different exercise. Think about your posture. So it's an obvious one and it's one that everyone's talking about in terms of your work setup at home. Have you got your chair and your desk sorted? Now it might be that actually you can't have an ideal setup. So therefore just making sure that you're changing your posture regularly, you're changing your position regularly. You know, sit in a different place and change positions every half hour or an hour so that you're getting up and moving your spine around. Try and add in some small movements, some small exercises regularly during the day so that you are giving your posture a bit of a break and a bit of a chance to adjust and take the strain off any one area. So the NICE guidelines for treating low back pain state that a combination of approaches is best. So seek some expert advice so that you know what's going to be relevant specifically for you. Keep active, keep moving. Think about your daily postures at home. Take medication if you need to. And consider the psychological and emotional side of it. Maybe some meditation, thinking about your sleep patterns. All of those things should help you if you are in pain. So what about Pilates? Well, we know that Pilates has been proven to help in managing and treating low back pain. I would really recommend that you see either a physio Pilates instructor or a rehab trained Pilates instructor who can properly assess you and your specific needs and give you a program to be suitable for you. So how does Pilates help? Well, Pilates exercises help to redistribute the load through your spine. By getting each part of your spine, your upper body and your lower body moving well and strong, it means that there's not one area that's overloaded and therefore potentially causing pain. We really work on the mobility in your spine. So if perhaps your thoracic spine, your upper back, is a little bit stiff, it doesn't like to move and extend, that's going to put more load on your lower back and potentially aggravate pain and symptoms. So by getting you moving through your whole body, getting your whole spine moving well and giving you good range of movement, that can help to reduce pain. That also helps with your posture, because if you've got good range of movement, you're going to be able to be in a good position, a good posture. You're going to be able to shift it and move it and change it around during the day so that you can remain comfortable. Pilates is also excellent for strengthening your muscles. And we know from the research that people with low back pain often have weaker muscles around their spine, the deep stability muscles around their spine, in their abdomen, their back and around their pelvis. And Pilates really works at targeting these muscles close to your spine and around your pelvis to give you that inner strength and stability, to then be able to work your more global muscles on the outside of your hips and down into your legs and your upper back and arms, so that you've got a whole body workout and whole body strengthening to help prevent you from getting pain. This in turn will improve your movement patterns. It will enable you to sit to stand better, walk better, go up and down the stairs, carry things, maybe going out for a run, walking, doing those things more efficiently, more effectively, and without the risk of injury or without the risk of causing back pain. even just sitting for long periods at your desk. If you're stronger, you're going to be more efficient, you're going to be able to do it without overloading your back. If you want to find out more, please do have a look at our other blogs on our website, and you can email us if you have any questions on info@complete-pilates.co.uk.